Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello there again. Hello, my name is Abby Tyler. I get my introduction out of the way. How are you guys doing? Hope all is well. My light's a little bright today. Um, Good evening. Happy Tuesday. Happy Tuesday. We're almost done with the month of September. Today, as you see the title of the show, September is Sickle Cell Awareness Month. And it's awareness, like most of these times I do awareness stuff, and the month is supposed to be celebrated, talked about, that we put more emphasis on it, but it's sickle cell awareness is every day. And talk about it today. So, again, my disclaimer, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without first checking with your own provider. Okay, so let's get started. I will put my glasses on. And now, sickle cell disease is one of those diseases that require, it's very intense. And I've tried to make it to where everybody can understand it. And I'm going to try to get everything in this one show. If I can't, I would just do the second part next week. Okay, so let's get right into it. So, what is sickle cell disease? Sickle cell anemia is when your blood count is real low. To sickle cell disease, I'll be doing the entire thing. Okay, I think everybody knows at least one person who has sickle cell, or a family member, a close friend, or somebody of somebody who has had sickle cell. So let's get into that. Okay, so what is sickle cell? I'm going to read the formal definition, and I'll get back to that. So sickle cell disease, excuse me, I'll be looking over here. Sickle cell disease is inherited. It's an autosomal recessive disorder, which means that in order to develop the condition, a person must inherit the disease causing gene from both parents. It tends to run in families whose ancestors come from Africa, Spanish speaking regions of the world, Southeast Asia, and Mediterranean region. Sickle cell disease again goes back with the hemoglobin. This disorder is caused by a defect in the hemoglobin molecules. Hemoglobin is a protein that carries oxygen in the red blood cells. In sickle cell disease, the hemoglobin molecules have a slightly altered structure that can cause red blood cells to rupture and form a sickle cell shape instead of regular smooth shape. Okay, so let me just go in here. So let me show a picture on there, because when you're looking at when you have our blood cells that go into our blood, our capillaries, blood vessels, and all that too, the little round blood cells. Okay, so when they go in there, they go in there nice and smooth, and they can go. But when the sickle cell, it's like this. Let me open this up so I can give you a little thing there. Okay, so you see there, right? See the little round ones, how they can move smoothly into the capillaries, into all your blood vessels, and that's carrying the red blood cell oxygen. It's carrying the blood and everything that takes care of your heart, takes care of your liver, your lungs, your brain, and everything, and makes your brain run the way it's supposed to, make your body run the way it's supposed to run, operate the way it's supposed to operate. Well, on the right side, to where I'm moving my cursor over here, which will probably be your left. See that you still have the little red blood cells. They do have the little round ones, but what happens is you see these little ones that look like little hooks right there. When that happens, when it goes there, it comes to this area right here. So anywhere that could be like the elbow area, that could be any kind of vessel that go into the lungs or again to the heart, go into your liver, go into your kidneys and all. What happens? It blocks everything. It blocks the other ones from coming through. And because it blocks that, that's when patients have severe pain. And because they're born with that, because the cell is in the body like that forever, they have this lifelong disease that encompasses everything in that person's life. Okay, so let me just get that screen, get off the screen there. Okay, so we say, how is that diagnosed? In order for you to have sickle cells, like again, both your parents have to have it. Okay, so let's say the mother has the trait and the father has the trait. So you have a 1 in 4 chance of getting every birth that you give. Here, if you have two parents, open up the screen. If you have two parents, let's say this mother had to have the trait and the father has the trait. Every child that they have a 1 in 4 chance of having sickle cells. So one child could come out completely without the trait completely. Okay. One child can come out with the trait, the other child can come out with the trait also, and the other one can have the full blown disease. So every child that you have, the 1 in 4 chance, a 25% chance of you getting it. Now people could say, can it be prevented? Not really. It cannot be prevented because it can be prevented only if you, let's say you have the trait. Like I have the trait. Okay. In real life, I have the trait. I'm not just saying that for an example. I have the trait. I only knew that I had the trait because when I came to America, we had to get tested for all the other stuff in order to go to school. And they did my blood work and all that. And also for some reason they checked for that. So I guess, I don't know, maybe back then we're checking for that. And they checked it, and it's on it, and they told me that I had the trait. Now, when you have the trait, you don't have any kind of any symptoms and all that. Some people do have. Some people complain that they usually have like some anemia, maybe like the low blood count, or sometimes they have fatigue, meaning that you're tired. And all. But most of the time, you have a normal life. You don't have anything that really interrupts your life. But if I got married when I fell in love with my husband, let's say if he had the trait, then every child that we had after that, 1 in 4 chances. So that's the only way it can be prevented if you don't fall in love with somebody who has the trait. Now it's kind of sad because most people don't know they have the trait, especially if you were never tested for it, if you weren't born here, because the way it's diagnosed is when you're born, they do the HEO test, where they do all this test, to test all the babies and all, and they tell you then that you have the trait. So it's the kind of disease where it's kind of sad because you have to say, okay, then I can't fall in love with anybody who has the trait. And if you say, okay, I'm going to, me and this person are going to get together, we're going to be in love and have the kids, and we're willing to take that chances. We're willing to take the chance to have a baby. That baby may come out with a disease. You have to probably go to genetic counseling because it, like again, I said, it encompasses the entire life, your entire life, your entire child's life, and every other child who lives in the house and all that. Because this child has to be in and will be in the hospital for so many times in their life when they go into crises and all. I hope I can get somebody on that can give me like a personal testimonial about this. I was trying to get one of my friends who's an oncologist or hematologist, but I was scheduled, couldn't click. So that's something you have to talk about. So most people, when I tell people about it, a lot of people didn't know. I remember I was talking about it to another lady, and she said, "Oh my goodness, all three of my kids have the trait." So I said, "Well, hopefully, when they do get older and they start getting into relationships and all that, hopefully they don't fall in love with somebody who has the trait." It's just, so the most important thing is getting tested. Everybody gets tested so you know where you are. And again, like I said, you have to have some genetic counseling to say, if they do the testing and say, you know, you both have the trait, you have to make a decision whether you want to go ahead and have children and want to go through this. Okay. Not saying it's the worst thing in the world, but it's just that one of those diseases that really encompasses everything that goes on in the family. So let me go back to my back here already. So we did the diagnosis. Like I said, diagnosis is usually diagnosed as a child when you're first born, when they do the neonatal babies testing and all that. They tell you, okay, mom and dad, this child has the sickle cell trait, and just what does that mean? It means nothing right now, unless if you fall in love with somebody who else has the trait, and then they have run a chance of having a baby with that. Okay, so I will go into the symptoms. All right. So some of the symptoms of sickle cell, so it can be sickle cell crisis. That's what we call crisis. Sickle cell crisis is an episode characterized by severe pain and distress, and it's the most prominent symptoms of the condition. Okay, so I can go in here. Acute pain. Again, like I said, when those little cells are in the body there, instead of being little cute and little round ones that just go right through your bones and go through everywhere, the sickle. And because of that, it's like almost, it's up somebody said, when you tie your arm in order to get blood, where the tourniquet, and you tie it and you stop the blood so they can take out blood. That's, imagine if it made that like really, really tight, and then they just left it on. Okay, when you're doing blood work, they put it for maybe like 3 to 4 minutes or so. They hurry up, get the blood, and they hurry up and loosen it before you start getting pain. Okay, but just imagine that is there because all the sickle cells, they're all inside and they're blocking everything from going through. So your brain's telling your arm that, okay, there's something going on that I need you to hurry up and check and see what's going on, because that's really painful. Okay. and that doesn't happen, and it doesn't, and just like, okay, but so in order for that to be, for that to stop, you have to go to the hospital. So that's one of the things, they have to keep going back to the hospital and making sure they get some IV fluids and make sure they get pain medicine. So they're in and out of the hospital, in and out of the hospital, in and out of the hospital all the time. Hold on one second, I just forgot that I did not share this show, so one second here. I'm gonna just share this to my, sorry there, I'm just gonna share this to my other forum. I'm sorry. Okay, so we'll go in here, and I'm sorry, this is taking a little longer. Okay, share to. Okay, alrighty. So sorry about that. All right. And then the other one, the acute pain, which I said, like I said, they experience that. It can affect your abdomen, your back, your arms, your legs, your joints, especially the joints. That's why that hurts them. They tell you, my bones hurting me, my knees hurting me, my elbows hurting me, my back hurting me. Because of, like I said, everything there that kind of, yeah, that goes in there everywhere in your, sometimes you have your blood vessels when they go like that. I showed you the one where right where it makes a Y, it blocks that, and you're not getting oxygen, you're not getting all of that you're supposed to be getting, the red blood cells into your body, and it's very, very painful. These kids come to the hospital, and I took care of people who were like mostly like in the 17 to 18 years old, because when I worked in a hospital, I didn't do in a pediatric hospital, but from birth to all the way to their to they get to where they're 18 and start taking care of themselves, they always have to be in and out of the hospital and all that. The other one, chronic pain, of course, and sometimes they have to be on pain medicine. Most of the time, they have to be on pain medicine. And the part that I really that saddened me is when they come to the hospital and they're in pain, they're always in pain when, because they have to come to the hospital because they go into crisis. And you think that sometimes some of the doctors or some of the nurses or people who are taking care of them, they may be thinking, oh, you're just drug seeker, or you're doing this, you don't know, you're not that much, you're not in that much pain. And if nurses and other people are not familiar with that, because we're taught this in school, but it's not something that's like, they talk about it that much. In my entire nursing career, when I worked in the hospital, I only took care of two patients. Now think about it, over a 22-year period, I only took care of two sickle cell patients. Now granted, I didn't work to somewhere where it had like a high African American population, so maybe that's why I didn't come in contact with them that much. But they may come across as like, okay, yeah, you're drug seeking. Some of them are drug seeking because after a while, it's like, this is your life. This is what you've been going through all through. So it's not, you're not drug seeking because you want to be drug seeking. It's like you just want the comfort. You just want something to take away the pain. And sometimes that's the only way the pain can go away. And sometimes it's like a psych thing too. I just want it off my mind so I can feel okay because this is my life. Okay. We go on frequent infections. This illness, it makes you more vulnerable to infections because it damages your immune system. After over time, the chronic infection, all that damage your immune system. So like everything that goes around, you'll get it. If it's a cold, you get it. If those who, when COVID came around, they were high risk of getting that also. The flu, they get it, and they get it even worse. Okay, jaundice, because all of that, it eventually it destroys your liver. People say jaundice back home, when your eyes are yellow and your hands are yellow, it destroys, it eventually causes damage to the liver. You have you have issues with your liver that can also, like, because the liver kind of flushes out almost everything out of your body. So that's also important too. Those are, I'm just listing many things that these kids go through. All right, growth problems. Children with sickle cell may have a smaller than expected height and weight as a result of chronically low oxygen levels during childhood. Because if your body is not getting the oxygen and everything you're supposed to get in order for you to grow, you're going to appear smaller than most people. Some, it's not always, but most of the time that's the case, because from the time you're little, you're not getting the oxygen like a regular child will be getting. Okay. Swelling of the hands and feet. This swelling can be painful. It can occur during the crisis, and when you're not experiencing, even when you're not experiencing sickle cell, because they always have other things going on. And I mean, it sounds like, I'm not trying to make it like it's so sad, but again, like I'm trying to stress the point that it encompasses everything in his child's life. They do have happy times and all that. I'm gonna get to that later. It's not just all grim. Just try to give the reality of having sickle cell disease. Okay, gallstones, red blood cells that break down, and you get gallstones. And anybody who's ever had gallstones before, you know how painful that can be. I mean, you literally have to go to the hospital to get that flushed out, and sometimes they may have to even do surgery to remove your gallbladder and all. and priapissin for boys, teenage boys, men or boys who have sickle cells and all, because not getting enough oxygen, they can have an erection that can be very painful, that they have to come to the hospital to get medication to release the stress. Okay, the complications from sickle cell, many of the serious consequences of sickle cell disease are caused by blood clots that can develop in any blood vessel of the body. Okay, so some of the complications are acute chest pain and difficulty breathing can be life threatening. Again, when I go back when I talked about heart disease and we talked about all these different things, if you're not getting oxygen to your chest and you're not getting oxygen to your heart, and the blood needs to go through your lungs, come to your heart, and go back through your body, get oxygenated, come back again over and over in order for your heart to work and in order for your body to function properly. If that's not happening, you're going to have chest pain, and eventually over a period of time, some of these kids end up having a heart attack because of that. A how the high they also had a high risk of stroke, blood flow in any of the blood vessels. That any kind of blood supply, that anything that stops the blood supply and oxygen from going to the brain, there's a high risk of having a stroke from that. Eye problem, because the lack of oxygen from the disease and all that too can also affect the eyes, and also you can become dehydrated too. So, and other necrosis, because the blood, you're not getting enough blood supplies to the legs, blood supplies to everything. Yes, eventually the blood vessels in the area will die, and you will have problems with your feet, you have problems with your hands and all. Any of these can be life threatening. Okay, so that's one of the main reasons why it's important. It's important that when you have this, so some of the ways that we can work around that. Let me see here. I'm just gonna make sure if I see any comments first before I'm just gonna keep my hand there. Okay, 1 second. Now, as a primary care provider, I will be taking care of the first part. I work in combination, in collaboration with the hematology. With a hematologist, most of the time you'll be seeing a hematologist. With this, you and eventually you need a cardiologist, also the heart doctor, because and when you start having the complications with your heart, you will probably be seeing a neurologist as well. You will be seeing a social worker, because most of the time when these kids get older, they move out of their parents. They're not in the pediatric care anymore. Remember, I told you, when you transition your child from the pediatric setting into the adult setting. So if you have chronic illness, you have to they start doing things to themselves, and they start having to talk to doctors and all the social workers, and they have to start talking directly to the child. So you need a social worker, because eventually they may not be able to work full time. So have to get help with housing, help with other things, so you do have a productive life. Back in the day, it used if you had sickle cell, there are many things that you couldn't do, because you're always in and out of hospital. But there's so much advancement in the therapy now, but we still have a long way to go. But there's so much advancement now, so a lot of people living much longer before, because before it was like, by the time you hit 20 or 30s, you were already going downhill. But now you can live all the way up to like 40s and 50s. The most famous person so far that has sickle cell that I can think about is T-Boss, and I'm dating myself from it's a group that came from TLC. Okay, she's one of the people who had she has sickle cells, and she's I think about 50 years old now. So going this, and by the way, I'm dedicating this to all the people who have died in the past. I had two cousins that died from sickle cell. I have a niece that has sickle cell, and I have a couple of people, other friends who going through this. So it's the parents, the family members, the siblings, and all that. Like I said, it takes over an entire life, where the mother or father has to spend time in the hospital while this child's in the hospital, because if your child's in the hospital, you're going to be there with them, and the other kids are left with the parents or babysitters, and especially if you're a single parent, it makes it even more difficult. Okay, so let me go in here, and I would get to. So I told you the diagnosis. That's diagnosed when they're in the hospital, when they're born from the baby. There are many different types of sickle cell disease, a sickle cell anemia, the whole thing. But the doctor, based on the testing, your doctor would be able to tailor your plan of care to that. Okay. So what are some of the treatments? Okay, it's important that you maintain and regularly schedule visits with your healthcare worker if you have sickle cells. If you may need to have prompt medical attention for the treatment of acute symptoms like pain or infection. So you want to make sure, especially as a child, you want to make sure you are up to date with all your medication, with all your immunizations, all your child immunizations. Make sure you get it. The ones that contraindicated, meaning that you're not supposed to have, your doctor will tell you that, but make sure everything is up to date. Keep in mind the severity of the sickle cell disease, so you may not need all these treatments and all, but some of the treatments that are there, the most important thing is preventing infection. So these kids will have to probably have to be on not probably they put them on penicillin. Children up to age 5 are often given oral medication penicillin in a daily basis to prevent pneumonia. And you have children who need to take medication. You know how hard that can be. They don't want to be taking the medication. They don't want to be feeling different than their friends. They just want to go ahead and have a so you have sometimes you may have to see a counselor, because a medical counselor too, because the problem is I talked about I think I did a show about having a child with chronic illnesses, how that can take over everybody's the whole family structure and all that. How it can be a little bit burdensome to everybody, not so much burdensome, but the fact is real life. You're dealing with real life issues. That's chronic issues, and you may have to, sometimes one parent may not have to work because the fact that you have to be home with this child most of the time, or at least taking time off from work. Okay. So they also give them hydroxyurea that can reduce the frequency of the sickle cell crisis, and they also help with preventing chest pain and all. Okay, adult with sickle cell, they also have to take the penicillin, childhood vaccination. You have to make sure, again, wherever you are, you have to be close enough to where your doctor's office is, close enough to a hospital. Luckily, in America, depending on where you live, the hospitals, all your hospitals are very close by. And if you have to travel, make sure you have your doctor's number, your phone, the pharmacy number, and have everything written down somewhere, everything this child's taking. So if you run into any crisis, let's say you're on vacation, or you go to a family member's house or go out of state, you have all the records and all the family members who are responsible for this child, who's supposed to know everything about this child, is aware of everything that's going on. Okay. COVID, if during the COVID season, we're going back into COVID season again, and cold season, make sure they have the flu vaccine, make sure they have the COVID vaccine. They may need blood transfusion, because over a period of time, they lose blood. And if you're out there, who can donate blood, it's important. When I did a show about giving blood to the red blood to the blood bank, these are some of the people who need that in order to live, because if their blood count is low and they come to the hospital, we need to give them blood. So if you can give blood, please go ahead and give blood, and make sure they know their blood type. And also, when you go to the hospital, we usually test every time, every 3 days anyways. And if you have to give you blood, we usually test with the blood anyway. So that's something, if you have any issues with getting blood and you have sickle with your provider, because that can become a problem if your religion or something else says that you can't get blood. This child literally needs blood to live. So that's something you have to have that conversation beforehand. And sometimes they say bone marrow transplant, but that's way past, and you have to get tested and have to get a match and all that too. Okay. And the most important thing with sickle cell anemia, again, is like preventing strokes. We talked about stroke prevention in May. You can go back and watch that show. If you having any kind of chest pain, you want to get to the hospital. If you having any abrupt change in vision or speech, if you're getting a little dizzy, the side of your face is on drooping a little bit, and the person's not speaking the way they're supposed to be speaking, get them to the hospital as soon as possible. Because again, the sickle cell, everything that blocks away the oxygen and the blood from going to your brain, will cause a stroke. That's one of the complications of that. T-Boss, also the one I talked about, she had a stroke before. You can go read more about her in there. Okay, so what can you do while you're home? That's some of the things we would be treating you with. And again, like I said, you will be following up with a hematology for most of this, the hematologist and your family doctor. Okay, this is all I'm just introducing this. This is not comprehensive, so you can go back and read more about this and speak to your doctor about it. Okay, so what are some of the things you can do at home? Let me go there. So again, don't make any changes until you speak to your doctor. You can take folic acid supplements and choose a healthy diet. Your bone marrow needs folic acid. You can take some other vitamins. Ask your doctor about folic acid supplements. Eat a variety of colorful fruits and vegetables, as well as your whole grains. Drink plenty of water. Drink plenty of water. Drink plenty of water. You have to stay hydrated. It is so important that you have to stay hydrated, because think about it. If you have your blood vessels and everything is going through there, if you're not hydrated enough, you already have the low sickle cell that's going to block everything there. So if you don't have enough fluid in your body, that's going to cause the increased chances of you getting the block. So stay hydrated as much as possible. Speak to your doctor. See how much you need to drink based on everything else that's going on with you. Again, speak to your doctor first. Okay, so dehydration can increase your risk of a sickle cell crisis. Drink water throughout the day. aiming for about 8 glasses, 8-ounce glasses a day. Increase the amount of water you drink if you exercise or spend time in a hot, dry climate. Most of the things, so if you're in the sun a lot or if you're out places where it's really hot and humid, you have a higher chance of becoming dehydrated. So make sure you're drinking enough. Okay. Avoid extreme temperatures. Exposure to extreme heat or cold can increase your risk of sickle cell crisis. So lives, sometimes it's not possible to, like, okay, I can live in the ideal place where it's like Hawaii, where it's nice and all that. It's not always possible. So, but try as much as possible to avoid extreme temperatures. Okay. And sometimes that would mean moving to somewhere where you really don't want to be, but because of the love of your child, you would have to do that. And as you become an adult, you would have to make that decision too. Let's say if you live down in Texas area, that you'd be like, okay, it is too hot here. I need to move somewhere where it can't be too hot and too cold. I can't move all the way to Alaska, so I have to move somewhere where it's like in between. Okay. Exercise regularly, but don't overdo it again because you don't want to become dehydrated. Talk to your doctor about how much exercise is right for you. Use non-prescription medications with cautions. Important, like if you're using ibuprofen and all the Motrin and all that for your pain, remember all that, like I said, all those medications, ibuprofen, Motrin, all these different things, and work, it kind of like hurt your stomach lining, can cause some bleeding, and also those medications can also work on your kidneys too. So you want to be careful. You'll be doing blood work. Your doctor will determine how often you have to get blood work done, so you can get that. So you can make sure that your kidneys and your liver and everything's not being impaired. Okay. Again, like I said, ask your doctor before taking non-prescription drugs. Don't smoke, because if you smoke, it increases the chance of you having a crisis. Alrighty. So let me see. I didn't want to. It's 26, and I don't see any questions right now. Okay, so what can you do when you go into, let's say you're going for your doctor's appointment? So again, you can be going. You have to go to the doctor appointment very often. So what can you do? Make a list of the things you're gonna be when you go see the doctors. Make a list of your symptoms. Include anything that seem unrelated to the reason for which you schedule your appointment, and then when it begins. So when you get there, so the doctor's gonna talk to you about it. Say, okay, what's been going on so far? What kind of symptoms are you having? Because sometimes they can change your medications around that will prevent crises. Because the most important thing when it comes to sickle cell is like making sure to keep you out of the hospital. Okay, we want to keep you out of the hospital as much as possible, because when you go to the hospital, you go there to get healthy, but there's always a chance that you may also get something else while you're there. So because you breathe in the same air, yes, they have all the different vent system and all that, but the most important thing is to keep you out of the hospital. Because even when you're in the hospital too, you're missing school, you're missing playing with your friends, you're missing the time where you need to be, like, a child. And as you get older too, and you have a job, you be in and out of the hospital, in and out of the hospital, you're gonna lose your job. So there's most of the things that it takes so much of your life. So you have to find a way to make it possible so you can live your life as much as possible. So let me see. I'll try to do that, Jackie. Okay. Keep your personal information, including family members, whether anyone has sickle cells. Make sure you talk to your family members. Again, if you have the trait, again, you want to, and anybody else who has the trait, talk to them over and over. Tell them, okay, it's important that if you have the trait and you're gonna get older, you're gonna get married and all, make sure the person who you're gonna be fall in love with get tested, and you'll see where you are and say, okay, this is what we want to do. This is what I want to do. Read more about it, and say, okay, I'm okay with this, and I'm okay if I have a child that has sickle cell. There's nothing wrong. I'm not talking anything about having a child, anything bad about having sickle cell. As with any diseases, any kind of diseases that can be passed on, inherited, it can be passed down to your child. There's always a time where we say this in genetic counseling. Okay, well, we say this is what you're going to be experiencing. Be okay with that. Be content with saying this is what's going to happen to my life. May happen to my life, and I'm okay with it, because that child that you're bringing into this world, that child deserves all the love, and that child deserves, do not, you're gonna be able to. You don't want to be passing on your grief and your stress and your everything else onto that child. It's gonna be so difficult not for you to do it, but that child doesn't deserve that. So it's important that you make sure that you get genetic counseling prior to doing this. Okay. And ask the doctor's questions and all. Bring your family member with you. Ask enough questions when you bring your child to the doctor. And sometimes you'll be like, okay, this is not what I'm doing. This is what's going on. And you also talk to your doctor while you're there. Okay, it does, this is what's going on. I really need to talk to somebody. If you need to talk to a counselor, And you need to, there's church groups, there's so many groups out there. You can talk to somebody. Don't just keep it on, because a lot this, again, like I said, yeah, you're gonna need to be talking to other people who are going through this, or talking to somebody who can counsel you through this. Okay, join a group or something like that. All right, bring a family member with you if you want to. If you're at the doctor's office and you feel frustrated and all, and somebody can speak better for you, when calmer in a more calmer in a calmer manner, get somebody that will help you there. Okay, so for sickle cell anemia, questions to ask your doctors. All right, there's some of the questions to ask your doctor. I was going to make it two parts today, but I'm just going to make this quickly. So, what is the most likely cause of my child's symptoms? Are there any impossible causes? What treatments are needed? What treatments are available? Would you recommend? Again, like I said, you'll be working with your primary care doctor, and you'll be working with a hematologist. And depending on the complications later, you may be talking to other specialists as well. Okay, what's the prognosis of my child? Like, so okay, what's going on with my child right now? How, where do you see him or her in the next 10 years? Where do you see him or her in the next 20 years? And now understand there's so many different advancements to these different to treatments right now. How can I get that? How can you send me to listen? Because most of the time, like if you're living in a small city, you may have to go to a center city hospital, a big city hospital in where you live, because the doctors that have the most up-to-date care would be in the center city hospitals, and most of those hospitals are teaching hospitals too. So they have like the most up-to-date care, and it can care for your child much better. So again, like I said, it may get to a point where you may have to move from where you are in order to better care for your child, in order for your child to get the best treatment possible. Okay. And you can ask, do you have brochures? Do you have other things? And your doctor will be asking you questions. The doctor will actually, like, when did you notice your child's symptoms? Have you had any continuous, or is it occasional? Again, like they can write according to the pain medication. If the person is a child, because eventually it will be chronic pain, so the child may need different kind of pain medication. So they're going to be depending on you to ask those questions. And the younger the child is, they have to monitor that pain medication too. Also, when they go to school, you have to tell the school nurse that this child has this sickle cell disease, so the school nurse can also be ready to when the child's going to something, so they can get the child to go to the hospital as soon as possible. And then you may have to restrict the kind of sports that they play as well, because again, like I said, the more strenuous the sports is, and also anything that's going to cause dehydration, you want to talk to the school, say, okay, my child cannot participate in that, or my child can participate in that, but to in a limited level, because I don't want them going into crisis. Okay. And okay, and then what do you have to talk and have like a real open conversation with the child, and the doctor and all that, to say, what am I doing? I really need to, I need to know exactly what's going to happen, because sometimes, as doctors, as providers, we try to like not give too much. But again, like I said, you want to have that information to say, what are the kind of things I'm looking at? And one of the stuff that I think about, and that I was taking care of this other girl, both of them were like about, one was about 33 and one was about 19. And like I said, these kids grow up, and they grow up and their parents get older. So you want to get that child ready to be able to face the world, because anything, that child's going to school, and then that child want to get up when they get older, they're going to be looking, trying to get a job. They're going to, but then it's like, okay, honey, you cannot get a job that's going to be too strenuous, and probably have to get a part-time job or something, because anything that's going to keep you away from your job, you're going to go through all that. And not to tell the child that, okay, there's something wrong with you, or there's something, what's wrong with me? Why am I not okay? I didn't bring this on myself. Why did you do this to me? Those are the kind of questions that your child's going to be asking you, and you're going to have to sit there. And I talked about mom guilt last week. It goes back to, also, I did another topic about, parents who have children with chronic illness. That can tear at your very soul. Okay, it can tear at your very soul if you sit there and say, if I only knew I had this, I wasn't going to go ahead and have this problem. I wasn't going to do this. I wasn't going to do that. But the child's here now, so that's why it's important from the very beginning. See if it's possible that you start getting some counseling, so at least that way, when those incidents come on, you can be able to talk about it and say, okay, say, honey, let's just sit back and talk. I understand you, and just sit there and let them talk, especially when they become adult, because this is their life. You can say everything you want to say. They're the ones that are going to be facing it, okay, as they get older. Because I remember when I had these two women that were taking care of women, 19, and one was 33. And one, she had been coming so many times, and her veins, they could barely pass, and we could barely find any veins to do her blood work. And she had to go to dialysis because her kidneys had failed. Her lungs, I mean, she had two strokes already, and the parents had moved away. She had nobody else to live with, so they were working with the social workers, were working with her, trying to get her placement. And she had been in and out of the hospital, in and out of the hospital, and it's like she was so tired. And one day we went back to third, going back, and she said, you know what? I'm just tired. I'm tired. I don't have anybody. My mother got older. She moved away. I have nobody. I would never forget that. And she's like, I'm tired. I'm tired. I'm tired coming in here. I'm tired. You guys telling me that I have, I'm doing this. I just doing this for drugs. I'm just seeking drugs. I need a drug. I need a medicine to take away my pain. I'm in pain. But you guys can't see that because you think when I come in the room, you think I'm just looking for pain medicine. You think I'm just, a drug seeker, and I'm tired of it. And I remember she finally one day she was in and out, and she was always in and out of the hospital, and I remember one time there was one of the doctors or something. I mean, she came inside, she was a patient. I mean, her hair looked really nice. And I remember one time one of the doctors like, oh, her hair looks really nice for somebody who's in pain. And it's like, and that's one thing too, like we have to be educated on this thing because most people, again, we don't get these patients that much as depending on where you work. And it's like, oh, maybe I said, maybe she did her hair just to make her feel good. Sometimes you can be in the worst situation in the world and it's just fixing your hair or wearing a pretty dress or doing your nails or something just to make you feel good. Because what is she doing? I mean, she can't work and she's back and forth in the hospital. Even if she wanted to live a normal life, she's one of those patients who had like really severe complications. Some people don't have it that bad, but she was one of those who had really severe complications. And if you're not in the financial situation, in condition to sit there and be able to like, okay, yeah, I have a family member who have money and this and that, it can help me here. You're going to find yourself where you're asking people for a lot of help, and you're going to find yourself at the mercy of people saying things like that. And also she did that over, and then one day she just got decided that she didn't want to do it anymore. She said, I'm tired. I'm tired. I don't want dialysis. I don't want anything because I can't get transplant in a way. I don't want that. And I remember she said, no, that's it. And she was with us. Yeah, she was with us, and I think we had moved her to another floor and all. And I think about 2 weeks she was in the hospital, and then she of course she wasn't getting dialysis anymore. And when your body cannot take out everything, and she passed away. And I remember it was so sad. Everybody's like, it was so sad. And the doctor that was taking care of her, she's like such a sweetheart. She's such a sweetheart. I remember she sat on the desk and she cried for a whole hour. We're like, that's okay. I mean, we're comforting. She's like, I wanted to do so much for her and I was helping her out and it was this. And at one time I even gave her some money so she can get some stuff. And she was so close to this patient because this patient had been in and out of the hospital for so long. Okay. So, but the patient's like, I'm tired. And we had another younger girl who's the one that was 19 years old. She was rolling. She used to come in. She's like, okay, I'm dehydrated. I need to get some. So I was sitting there talking to her. I said, so what do you do? She goes, I'm trying to go to school, but with this and all that. So I'm taking some online stuff. And it's like you have to talk to them because they have to see like a purposeful living because there's so many advancement in the treatment right now. Like, like I said, before people used to like die like 19, 20, or they had so many complications by them. But now they can live for a much longer period of time and really productive life. Okay. So some of the ways how coping and supporting with this because it's the most important thing, and coping for providers too because like again like I said we saw her so many times. I still remember her because she used to have this fancy hair and she had this like she had this pocketbook that was all nice and pretty, and she always had it with her all the time. So if you're someone and your family has sickle cell, you may consider the following help. Finding someone to talk to. Living with a chronic illness is stressful. Consider consulting again with a mental health professional, such as a psychologist, a counselor, a social worker, to, again, talk to your doctor and see if you can, they can send you to see a mental health provider. Join a support group. Ask your healthcare provider about support groups for families in your area. There's so many sickle cell support groups on Facebook alone. So you can just look them up, and there's some in your neighborhood, in your vicinity where you live. So you can just ask your doctor at any hospital. You can just go there and say, do you have a local sickle cell group in the city? So after that, explore ways to cope with pain, work with your healthcare provider to provide ways to control your pain. Pain medication can take the pain away, but different techniques work on different people. So you have to try different things: heating pads, hot baths, again, not too extreme, massages, and physical therapy. Physical therapy can do a lot of helping you with that too. And learning about sickle cell anemia to make informed decisions again about care. If you have a child with sickle cell anemia, learn as much as you can about a disease. Again, like I said, ask questions during your child's appointment. Ask your doctor, healthcare team to recommend good sources of information. Again, you want to make sure that you get enough care. Okay, let me just look in here. And the crisis can be unpredictable, so the most important thing is making sure that you stay hydrated, do everything that you need to do. Again, going back to my initial points, it can be diagnosed as a child, as an infant. When the child's born, to do the neonatal screening, they can test you that. If you have the trait, most people don't have any symptoms, they have the trait. I've never had any symptoms, I have the trait. And I remember when I met my husband, I was like, oh my God. That was always in the back of my mind. Please don't let anything happen. And we were still dating. And I was like, when you go get tested, make sure you don't have the trait, because you have to say, okay, do I have to find somebody? Of course, you know, it's people. My husband, he's like, oh, well, that would have been a nice way to break up with me. Oh, I can be with you. You have, so, but it's like sometimes you have to like infuse some fun and stuff into that too. So making sure that if you somebody dating somebody, if you're getting close to getting, but the first thing about it, I would say, and most people, and the most thing when I started doing the sickle cell stuff too, the most important thing, if you're African American, Black, like again from Africa, Black ancestry and all, or Black American, whatever. If you're Black, you know, make sure it's just important to get tested, especially when you're younger. Get tested, and you plan on having children later on and all that. Get tested, so at least if you have the trait and you meet somebody and that person already knows about them. Again, then you can go ahead and make sure that and have genetic counseling and say, this is what I want to do, and I'm okay with it. So, and everything that I listed here, there's so many these kids and these people, they go through a lot. Encompasses the entire household. Okay, it's not something where you can say, okay, this child's going through this, so it's okay, because you can go to crises. Let's say you're getting ready to go somewhere and this child going through crisis, you have to take that child to the hospital. You can't say, okay, there's we're just, when we get to the hospital, we'll get to the hospital when we get there. And if you live in places like Liberia or anywhere else, I can't talk too much, but everywhere else, I can only talk about places that I know, that the healthcare system is poor. That's something that you want to make sure that you stay close to the city and area, so you can be able to go to the hospital there and get the help that you need. And I don't know how they can do that. How they can do that over there, where chronic illnesses, where you're going to be coming back into the hospital. And again, it's important that when babies are born over there, if they, I don't know how to do the neonatal screening over there, but it's important that everybody gets tested, the neonatal screening. Some babies are born outside of the hospital in Liberia too, so they may not get the testing. I would have never knew I had to trade it if I hadn't come to America. Okay, so it's important. That's one of the things when I talk about healthcare in Liberia and all that, is preventative care. All those things, that's why you need a primary care provider there. You need more primary care providers. So we take care of all that, and then we also refer you. And that's when you also need a hematologist, which is the blood doctor, and you're going to need a nephrologist, which is the kidney doctor, social workers, all of that. Again, like I said, because as this child grew up into an adult, and they have to take care of themselves, and they have to be there. And even if they fall in love with somebody else too, that can also affect their romantic life, because you're going to fall in love with somebody and they'll say, well, you're going to be in the hospital again, right? You're going to be in the hospital. So they have to be really mature when they get it, even before they get much older. So falling in love with somebody, be like, okay, this is me, this is what I have, and as long as you're willing to work along with me. And people who T Boss, again, from TLC, she's married. I know a lot of people who grew up as sickle cell and they have children today, so they fell in love and all that and got married. So make sure you get married, fall in love with somebody who's really, really, mature, that can deal with all that. And the parents, again, parents, that's something you may have to get help. You may have to get some counseling too, because dealing with this and all that, that can also, and also don't forget the other children. The other children will need just as much care and just as much attention. You all have to sit down and say, honey, I know it's important that I can't be at your game today. It's important that I can't go to your recital today. It's important that I'm not going to be home, and I may have to change my job, and dad has to do this, and I have to do this, and you guys have to go to grandma or do this. We please understand that your sister or your brother needs help. Okay, and they have a disease that requires them to go to the hospital often, or they require a disease that they have to go to the doctor's office more often. And because of that, I can't be with you all the time, but I'm going to try my best. So as soon as I get the chance to hang out with you, guess what? I'm going to be there. My friend said, she's told her other son, she said the daughter had to go in and out of the hospital. She said when she had a chance to go to her son's football game or whatever. She said I was the loudest one there. He said he used to be like, oh my goodness, that's my mother making all that noise. She said because in a way I felt guilty that I had to do that, but the fact is I had to celebrate him too, because it got to a point where it was like, okay, he had to always be the understanding one, but I had to celebrate it. And some people have more than one child with sickle cells. Okay, so you have to be dealing with both of them. Imagine having at different ages too, and there are different things when you're dealing with that. So it's something that they can have a productive and fruitful life if you learn everything that goes along with it and try to do as much as possible to prevent the crises. Again, get your vaccination, stay hydrated, eat healthy, follow what the doctor's saying, avoid extreme temperature, do everything, and then of course get a support group. There's so many support groups on Facebook. You just type in sickle cell support group, and it's like I think I saw about 10 last time. I think I donated to one. I think there's another person on Facebook who her daughters in one of the groups, they were performing for that, and then I donated to that. So it's important. It's a disease that and also the more providers need to be know about it, need to be, because it's also for research. So giving blood and also for research purposes, they need to do that, because it only, any kind of disease that doesn't affect so many people, it doesn't get that much research and doesn't get that much exposure. So as people who have family members who are doing that, whenever there's something going on, please donate to it. Please, say, okay, there's a sickle cell group in my community. I can give a little bit of money here. I can give my time. I can do this, whatever it is that you're going to help find more, because there is no cure for it right now. So you can, and any little bit of money help for more research. That's the most important thing. So if you don't have it, or you don't have any family members that have it, just remember somebody else is suffering from it. So a little bit, even if it's like, you can say, okay, I'll give $25 this month, I'll give $10 this month, any little bit, every little bit help. Okay. So let me just see here. I'm just going to read a couple of comments. Okay. 10, 10 and Julie. Dennis said, thanks, Abby, for such an important topic. Thank you. Let me see where Jackie Jackson said. Jackie Jackson said, recently had a situation like this where the school was not equipped to meet several students' medical needs due to regular medical staff. Yes, most schools are suffering from not having nurses in every school also. And because of this, they had to be transferred to other schools. It was painful for these youngsters, but assisted them with proper transfers. Yes, those are some of the things that I talk about. It's like, it's life changing. It's life changing, and you made friends with everybody else, but because in order for you to live, is literally for you to live and to be able to live a productive life where you're not in severe pain and you're not in a hospital. And if there's no nurse at that school, you would have to change school, and you're leaving your friends behind. As a child, you're leaving friends behind. Remember when we moved from one place to the other, and it was like I cried every time because I was leaving my friends behind. But imagine telling a 5, 6, 7 year old, you have to move because you have to live. Basically, you have to live. So this is what we have to do. And again, sometimes the parents you have to move away because you have to be closer to like a major hospital where you can meet her, or and sometimes, and if that, it does have an effect on relationships, by the way. Some the parents have to be very strong for the marriage to work, or the relationship to work, because it takes a toll. Any kind of chronic illness that affects any child takes a toll on the relationship too. So then imagine if you're just a single parent having to go through that. Okay. And you see, Jackie said, by the way, these newly immigrants, yes, they were new. Yeah. Oh, I remember when you come to America and goes to your friends and you finally make good friends. You saw a friend because you have to, sit there and acclimate to this new life, assimilate and everything. You finally get to the point where you know the people and they're not teasing you or calling all these nasty foreign names. And then you have to move, you know. Thank you, Jackie Jackson. So yeah, so I don't see any other comments. So it's one of those things where, let me see. Kova said, interesting topic. Hi there, Kova. How are you? Thank you. So I mean, it's a disease that, it, like, again, I don't want to sugarcoat it, but I also don't want to make it seem like, oh my God, it's like death sentence. It's not. We're at a place right now where, again, like I said, so much advancement in different treatments and all, and the pain medicine, so they're not sitting there in pain all the time. And we have all these vaccinations now, we have everything, and counseling, so people can manage it a little better than it used to before. So we're at a good place. And again, if you can donate blood, go ahead and donate blood. If you can donate money to any sickle cell foundation, go ahead. So for more research, we have to put more research, more research. So 10, 20 years from now, they'd be like, oh yeah, I had sickle cell back. Like about 70, 80 years, are you still alive? Yeah, because of the money, the little bit that you give, and all the different testing and the research that everybody a little bit that put in the pot. That's why I'm here today. And every generation, and also to these money so they can also test people in different countries, especially countries where the healthcare system is very poor. So to make their system a little better, so they'll be able to help you, because there's no reason why a child that has sickle cell in Liberia should suffer and have a shorter lifespan than somebody in America simply because of the healthcare system. Of course, that goes with everything else, but that's another story for another day. So it's important. It's important. It's important. It's important. So if you guys have any other questions or comments, please leave it below. I'll respond to it later on. And I didn't want to make this like a whole hour, but we're close to an hour. So thank you all for watching. For those of you who are watching now, I say thank you. And for those of you who will be watching later, I say thank you as well. And thanks for all your love and support. Please share the show. Please share the show. Share on your pages, share it to your groups and all that too, because it's something that everybody needs to know. Okay, there's something that's affecting our community and also outside community too, and also other providers need to hear it, because again, when you go to the hospital, everybody will be taking care of you. Okay, so thank you all for watching, and I will talk to you guys later. I'll be on Friday for a Friday chat with Abby, but thank you all for your love and support. Please share the show, and I will talk to you guys later. Good night.